You've probably heard someone talk about having a gallbladder attack, right? That sudden, awful pain that just comes out of nowhere. But what's actually happening inside your body when one of those hits? Well, today we're going to dive deep and figure it out. So what is a gallbladder attack? We throw that term around a lot, but it's not just some random stomach ache. There's a very specific medical event going on, and understanding it is absolutely the first step. Behind all that pain, the medical reality is a condition with a pretty official-sounding name, cholecystitis. And really at its core, it means one simple thing. Your gallbladder is seriously inflamed. Now that word, cholecystitis, sounds complicated, I know. But check this out, it's actually super straightforward. It comes straight from Greek. Cholecyst means gallbladder. And you've probably heard iditis before. It just means inflammation. So cholecystitis literally just translates to inflamed gallbladder. Easy, right? Okay, so while there are a couple of different flavors of this, the vast majority, we're talking over 90% of cases, fall into one main category. It's called acute calculous cholecystitis. And that word calculus is the big clue here. It tells us the problem is caused by gallstones. And that brings us to the villain of our story. Gallstones. These little hard deposits are, by far, the #1 reason people end up having these incredibly painful gallbladder attacks. So how can one tiny stone cause so much chaos? Well, think of it like a plumbing problem. First, a gallstone gets stuck and completely blocks the pipe leading out of the gallbladder. It's basically a clogged drain, so the bile has nowhere to go. It starts to back up, pressure builds, and the wall of the gallbladder gets irritated and super inflamed. And if that swelling gets bad enough, it can actually start to choke off the blood flow, which can lead to tissue damage. All right, we know what's happening on the inside, but what does it actually feel like? Let's talk about the key symptoms to look out for, and who is most at risk for this whole situation. The absolute classic sign is a severe constant pain, specifically in the upper right side of your belly. But here's the weird part. That pain can actually travel up to your right shoulder. Strange, I know. On top of that, you'll often feel nauseous, might be vomiting, and could even run a fever as that inflammation gets worse. You know, there's this one specific thing doctors look for. It's a huge clue called Murphy's sign. Here's how it works. The doctor will press on that spot on your abdomen and ask you to take a deep breath. If your gallbladder is inflamed, it'll bump right into their hand, and you'll feel this sharp, sudden pain that literally makes you stop breathing for a second. It's a huge telltale sign. So who really needs to pay attention to this? Well, the risk factors are pretty clear. It's more common in women, especially once you're over 40. Things like pregnancy, obesity, and diabetes all play a role. A family history of gallstones definitely ups your chances. And here's an interesting one. Even losing weight really fast can trigger gallstones to form. Okay, so you have the symptoms. Now what? How does a doctor go from, this might be a problem, to, yep, it's definitely cholecystitis? Let's walk through how they figure it out. It's kind of like a detective story with 3 main parts. First, they listen to your story, your patient history, and do a physical exam, which, you guessed it, includes checking for that Murphy's sign. Then they'll run blood tests to look for signs of inflammation, like a spike in your white blood cell count. But the final piece of the puzzle, the real proof, usually comes from getting a picture of what's going on inside. And when it comes to imaging, the absolute best tool for the job is a simple abdominal ultrasound. It's quick, totally non-invasive, and it gives doctors a perfect, clear view of the gallbladder. They can see the gallstones, check for inflammation. It's really the gold standard. One of the most important things they're looking for on that ultrasound is a very specific number. They're actually measuring the thickness of the gallbladder wall. If it's swollen up to over 3 millimeters thick, that's a slam dunk, definitive sign that it's inflamed. Okay, so the diagnosis is confirmed. Now for the most important part, what do you do about it? Well, the good news is this is a very treatable condition. So let's look at what treatment and recovery look like. When you're dealing with acute cholecystitis caused by gallstones, there is one main treatment that's considered the definitive solution: surgically removing the gallbladder entirely. The medical name for this procedure is a cholecystectomy. Now, when you hear surgery, don't picture some old-timey operation. Today, the vast majority of these are done laparoscopically. This is amazing. Instead of one huge incision, the surgeon makes just a few tiny ones. The result? Way less pain, fewer complications, and a much faster recovery compared to the old-school open surgery. But it's not just about how the surgery is done, it's also about when. And this part is absolutely critical. Study after study shows that getting the surgery done early,
ideally within the first week of symptoms, is way better for the patient. It means shorter hospital stays and a lower risk of complications.
So why the big rush? Because letting an inflamed gallbladder just sit there can lead to some really, really bad stuff. The tissue can literally start to die. That's called gangrene. The whole gallbladder could even burst or rupture, which would spill infected bile all over your abdomen. And that can cause a massive, life-threatening infection.
And just how serious is a gallbladder rupture? It's incredibly serious. It carries a mortality rate of about 30%. Yeah, a 30% mortality rate. That number alone tells you everything you need to know about why you can't just ignore these symptoms.
So after all of that, what's the one thing you should take away from this? It's simple, really. Listen to your body. What we call a gallbladder attack isn't just a tummy ache you can walk off. And knowing what we know now about the risks, the real question is that kind of severe, unexplained abdominal pain really something you can afford to ignore?